Disaster Management Agency, a number of NGO organizations in Sierra Leone, and UCL, as in my department, as well as the more recently also the Department of Computer Science with some of their students. So crisis communication is, of course, important. You know it is. But what type of crisis communication am I focusing on predominantly? I'm predominantly focusing on the one that happens in a multilingual context. COVID-19 has made us all more aware that any context can be multilingual and that we need information in multiple languages for all sorts of emergency management purposes. But the ones that I'm most interested in and the one that is more pertinent to the project in Sierra Leone is crisis management in support of emergency services, of international humanitarian responders, as well as communication on which all the possible stakeholders, from people at risk to disaster managers, rely on when an event occurs that disrupts ordinary living. So the problem there is that communication is recognized to be crucial in these settings, but multilingual communication is not planned for very regularly, very efficiently, very consistently in many countries. And Sierra Leone was one of these countries. Even though we know very well that information flows much better when it is in a language that people understand, and even more significantly, in a format that people understand. Because low literacy and difficulties in accessing written language in general, for instance, for disabilities, are serious issues with the information flow. So what I intend to cover in this talk is 4 areas of the projects in which we worked. I first want to provide you a very succinct overview of what we did in Sierra Leone and why, but also what is the context in which this project had to happen, because this country had a specific experience of emergency management, and that is the Ebola experience of 2014. Which made a lot of emergency managers, a lot of institutions, and many local and international NGOs aware of the impact of poor communication. So they witnessed an increase of numbers in terms of morbidity, comorbidity, deaths during the Ebola pandemic, the Ebola epidemic, because information was not provided in a culturally acceptable way, and the language used for providing information were not suitable for the population. So deadly combinations for putting at risk all of the information that was circulating. So if we look at the relationship between development, as in developing countries, disaster risk reductions and the new agenda of the country, and we look at the issue of a multilingual communication, then Sierra Leone is a project that combines these 3 areas. And I will be showing you how it does it and why the United Nations Disaster Risk Reduction Terminology was a sort of catalyst for this activity. And predicting and anticipating a range of criticism, we know that it's not a perfect tool, but it's somewhere to start. And I'll explain why they wanted to start there. And ultimately, I will show you just a short example of what it meant having a collaborative project in this area. So development, disaster risk reduction, and translation, all in one. The reality there is that, and here I'm sure I'm saying something banal for all of you, but the overlap between development and disaster risk reduction, especially in countries such as Sierra Leone, is part of everyday life. So reducing risk means having more benefits from the projects that are ensuring the development of a country that in the first 2 decades of the 21st century has not seen a particularly easy start of the century, let's put it that way. And of course, these bullet points here are just to help me to give you a context that they don't in any possible way, shape or form represent the recent history of the country. But if we consider the post-colonial history of Sierra Leone in the 20th century, it became an independent country only in 1961. It is quite wealthy in terms of primary resources, so it's an interesting country for, let's say, corporate business. And there was a very long war that is still affecting young people, including the colleagues that work with me on this project, that have a memory, a lived memory of the war. So 2 weeks ago, the 20th anniversary of the Long Peace Accord of 2002 was a big event, because that war that finished 20 years ago has left the country in disarray. And it also left the country very fragmented, very much in conflict with each other. And to me, as a linguist, as somebody who cares for language, there's nothing more than the definition and the naming that they want to use for an association of professional translators and interpreters that they want to base on the notion of mediation. Now, for those of us who work with languages, the idea of language mediation is often used to mean, when we translate from English into Italian, from Chinese into Spanish, that is a form of language mediation. Sometimes it's only linguistic, sometimes it involves cultural elements, and so on and so forth. But the idea is that in Sierra Leone, they really want to put the emphasis on mediation, as in conflict mediation, conflict resolution, negotiation, as well as language mediation, because these things cannot be disjoint in the discourse, in the narratives of Sierra Leone. So the aftermath of that conflict was extreme poverty, poverty that is still a big element in everyday life. And of course, from the point of infrastructure, as we experienced during the project, the infrastructure is being damaged and remains damaged, and the infrastructure in terms of roads, in terms of travel, still represent a number of challenges, not just for emergency responders, but even for everyday living. So all of these elements mean that if you have a civil war that affected the national infrastructure, you're still recovering in terms of life expectancy, and more importantly, the mortality rate for the country is one of the lowest in the world. In terms of the under 5, we're still talking about 80 children dying out of 1,000. If you want a point of comparison, at the peak of the civil war in Syria, the number there was 3.67 deaths per 1,000 children. In Yemen, is less than what's an ordinary condition of this mortality rate in Sierra Leone without a war. The healthcare system was under pressure and remains under pressure, and that's why in 2020, November, December 2020, I was contacted because they say we're gearing up to a new public health campaign against COVID-19. We know that we're not equipped to speak to all the communities in our country. So how do you deal with multilingual communication? How do you deal with multilingual crisis communication? When you have 8 million residents in a relatively small country, where English is the official language, but is spoken as the official first language by less than 0.1% of the population, meaning that it's the second language for up to 10% of the population. All of the infrastructures communicates in English. When there was the epidemic of Ebola, all the information about public health measures was predominantly produced in English. The international humanitarian sector operated in English. So that's a big problem when you have a country that has 28 languages, 23 are still regularly spoken, and to each language corresponds a different ethnic background, often a distinct cultural identity, and one that is still in conflict with close-by identity. So the data that I'm showing in this map just gives you an idea of how differently distributed some of the languages are. The data comes from Glottolog, that is a very well-accepted resource for academic research on languages. Problem is with Glottolog, the information tends to be out of date. So meaning that a language that was still spoken 10 years ago by a community that then migrated across 3 different countries may still be placed where it was spoken 10 years ago. And because of migration flows within Africa, tracking languages is in itself a problem, a research problem, in fact. So this is very obvious for you, but you can see there's an overlap. If we're looking at some of the sustainable development goals, they say, promote healthy lives, reduce the mortality in children, and so on and so forth. So Sierra Leone here, against these targets and the targets of the international disaster risk reduction agenda, is not doing very well. And in fact, if we look at the development agenda as taking concrete actions to protect development gains from the risk of disasters, this was perceived by the national authorities as a priority. So of course there were different associations, different organizations at governmental level that oversaw emergency management in Sierra Leone. But in November 2020, they incorporated those in one single agency, a new agency that had the remit, had the purpose and the objective of being more efficient and not just covering emergency management measures within the boundaries of Freetown and the English-speaking part of the country. That was a big political statement. Because if you look at Sierra Leone and how it's featuring in terms of the World Risk the World Risk Index, and please don't shoot me, I'm just using this. I know these parameters are all open for discussion. They're not extraordinarily representative of real risks. But in terms of some of these areas, if we look, for instance, in terms of the exposure to hazards, Sierra Leone is not subject to the risk of volcanic eruptions, is not subject to earthquakes, doesn't have many other natural hazards beyond the very powerful floods that in fact affected an area in 2017, producing a serious localized disaster. But the problem is the vulnerability score. That is going better. When I started looking, when we started with the project, it was over 70. Now it's 68.87, but still, it means that Sierra Leone compares in terms of this index to Japan, that is exposed to far more dangerous and significant hazards. The problem with Sierra Leone is the infrastructural destruction left by the war and the complexity of the relationship between the different cultures, communities, and ethnic groups. So all of that is something that the National Emergency Disaster Management, the National Management Disaster Agency, NDMA, had to consider as part of its new objectives, its new constitution, dealing with what didn't work in 2014. And the World Health Organization has looked at how poor the response was in Ebola to rewrite its own crisis communication guidelines. Because in particular, Liberia, Sierra Leone, and Guinea were really affected by two factors: lack of trust with the government, and second, but extremely important at all levels of the communities, all levels of the local population, lack of trust on information in English. English is the language of the colonizers. There's no two ways about it. And that is problematic. It's problematic because it is the official imposed language. So even if education tends to be in English, education covers approximately 50% of the young population. So a lot of the population is still on very low literacy levels. So that means that English is not my language. English is the language of other people, and information in English is not for me. And that is when you connect language with identity in a rooted and ideological way. If the language in which you're receiving information is not yours, that information is not for you. I'm simplifying here, but it was an incredible factor in how the response to the Ebola epidemic failed to reach the communities that needed it. The other factor was, of course, the cultural barrier. not engaging with different burial procedures, not engaging with the fact that traditionally, medicine was not for Black people, as we've been told several times. In particular, in Sierra Leone, medicine was something that was for other people, was for the British when they were there as colonizers, and in particular, it was provided as part of the healthcare service provision only if you had a role to play in society. So you had access to health only if your employers needed you. And you can imagine how conflictual that information is. And we're saying, okay, but that was up to 1961. How can it still have an impact now? Because that lack of trust has never been challenged. The education system works sort of in parallel compared to the local communities. And what we see is something that one of your lecturers, one of your professors noticed a few years back, that if you don't give the due attention to languages in a crisis, that is going to have cascading effects. And the other part that I've golden here, language is a crucial means of understanding the perspectives of the members of social groups. And this was absolutely true during the 2014 Ebola epidemic. There was a limited understanding of the perspectives of those who were supposed to be receiving the message. Now, there's another problem there. Communication cannot be unilateral. When you are communicating with somebody, there's information exchange. It goes in multiple directions. If you're sharing, giving information, something is not going well. And I'm not even looking at the British government and its plan for COVID-19 measures, when they're giving information that doesn't apply to them. But that's part of the problem that the National Disaster Management Agency was set out to resolve. And the idea there, as reported by the Sierra Leone Telegraph, is in the words of President Julius Maada Bio, who is in fact has been a researcher in development studies and is developing a slightly different political agenda for the country, but the political dimension isn't part of what I want to say. What is important is how they perceived the creation of the agency, because they believe that mitigation and climate change resilience must be done in close collaboration with communities. Now, this notion of mitigation, of course, puts together two aspects: disaster risk reduction and preparedness towards them, but also a better agenda, better debate around climate change. The two of them were the reasons why YMCA Sierra Leone contacted us and said, we're running a number of community-led workshops and trying to discuss disaster risk reduction matters with different language communities. And we're doing this through English. How can we have a collaborative and participatory approach to discussing this reduction if we're always talking about it in English with terms and terminology that is not automatically transparent? Now, the problem isn't with the lack of transparency of the terminology. The problem, some of you may argue, is with the terminology itself, which is a compromise of many different points of views, and is trying to summarize extremely complex science. So you cannot do that in 38 terminological elements. One could argue that, of course, you have to start somewhere, and the agenda of the United Nations Disaster Risk Reduction terminology is to agree on a compromise definition. Now, you can talk about language as a convention, you can see it as a political agreement, whatever view you have, the terminology is there to create this exchange. And I'm very happy to hear what views you have about terminology, because I know that it's not an instrument that appeases the international community that works in disaster risk reduction or the community that works in climate change. But the fact is, if you decide, as part of your emergency management plan within the National Disaster Management Agency, to educate, to engage the public with the disaster risk reduction agenda through this terminology, and then you need to explain the terms. no terminology exists without an understanding of the terms. At least that's certainly what we teach to our translators. You cannot do medical translation if you do not know the subject matter, the subject domain that you're translating. Is it possible to work in the area? So every terminology should come with that agreement so that it can do something, it cannot do everything. So I misled you. I say this is a succinct overview of the context. It took me a lot longer. It took me well over 20 minutes. But the context was difficult. And what I had not anticipated at all was how difficult the context was for the people in delivering the project in itself. So my involvement was all remote. We were in lockdown when we started, and we were in lockdown when we finished. The project was to translate the terminology into the 5 most spoken languages of Sierra Leone, with the view of testing this system of collaborative translation that involved both the emergency and crisis managers of the new agency, the regional officers of the, in particular, the regional officers of the disaster management agency, and all of the possible bilingual who work for national and international NGOs. So it was a collaboration to ensure that everybody who had language competences and an understanding of disaster management in the field, as well as an understanding of community needs, were involved. Not easy to manage, and Jonas and Pius made a fantastic job of that. So YMCA Sierra Leone was the instigator of the project. They said, we need to do this project together. And the United Nations Development Programme was one of the main sponsors, providing 33% of the funds. And the National Disaster Management Agency was involved in terms of providing disaster managers who were bilinguals, who knew the needs of specific areas of Sierra Leone, and who wanted to engage with the terminology in a language that was meaningful for their communities. And then there was also a very strong involvement of the Office of National Security that oversees not just the disaster management side of things, but also the new early warning system and other platforms that have been developed to deal with disaster risk reduction. Brought for the RIALT, and sorry for my German that is non-existent, was another sponsor who was very keen to support the development of new skills, soft skills and hard skills. And my point of reference being the Translators Association of Professional National Associations Worldwide, the FIT, is now sponsoring the next phase, the consolidation of the hard skills. Emergency, that is an Italian NGO that works in the healthcare sector, has provided us a lot of tips on what happens when they're communicating healthcare matters on the ground and how they use interpreters, how they use local interpreters. And UCL Grand Challenges supported me in being involved. So, 4 simple objectives. Translate in 5 languages. Create multilingual resources that can be reused. And we are reusing them already. And they're being, in theory, tested for further use in other contexts. Okay, contexts that are very much concerned with disaster risk reduction. And the third principle is the one of participation. So enable Kono, Krio, Limba, Mende, and Tenne communities to have information about the disaster risk reduction agenda in a way that matters to them. And Pius has been incredibly busy making sure that all the different communities have access to the information and have been able to participate. Ultimately, we want to shift this into a long-term collaboration that creates not just the terminology resource in 5 languages, but creates the resources for engaging with multilingual communication. Multilingual communication does not replace monolingual, efficient communication. But what it does increases trust. And that's where it's coming in. So if you look at how these languages correspond very much to boundaries of people's ethnic communities, and you then try to overlay that particular map of languages with the areas of conflict during the Civil War, you'll see how important the linguistic and ethnic dimension is, and how much a language becomes a barrier, not just to communication, but to much more. And I want to give you an example that works very well, the term vulnerability. Do I need to explain the term vulnerability to this crowd? No, I would imagine not. And you all agree that it's a fantastic term that is very clearly defined and everybody loves it. There's no debate. Yeah, except, I mean, J.C. Gaillard said it's not really for everybody else. Okay, so I'm mentioning the work of J.C. Gaillard because one thing that he says about vulnerability is that vulnerability is a fantastic term, and it is a true diaphragm of how you can engage with risk reduction. But if you don't give agency to the term and the people that use it, becomes meaningless. And here we got the example. So I'm sorry, I will not pass this to JC, but when one of the translators was engaging with the translation of disaster, hazard, and also the ways in which there is a relationship of causality and effect, it returned to me the same term. And as a translator, I'm always aware that no language has a one-to-one equivalence between one term and a concept. And no language can have that with another language. So the one-to-one equivalency is what Google Translate can sell you for a day and say that if you look up your language in translation to all the other languages, you get a good rendering of your language, but it's not the reality, it doesn't exist. And here it was fantastic. So vulnerability could not be translated because the potential for something to happen does not stand as a word on its own in common, such as hazard. It can only be described in words such as kazako and bekana, meaning something that will cause a disaster is coming. And minisa can also either be the event itself of the effects or the effects of the event. So the after effect, the aftermath of the disaster. And so how do you describe the potential that comes with the concept of vulnerability? You cannot. We don't have a term. So we have, of course, ways of explaining it, and there are plentiful explanations. And the terminology was, in fact, a way for translators who are native speakers of these languages to engage with disaster managers who have been conceptualizing and using these ideas, however limited they can be, in their work to understand, okay, when I'm talking about vulnerability, what do I need to convey? What do people need to understand by this concept? Why is it useful? Why does it imply that there is somebody responsible and it's not the earthquake's fault that L'Aquila in Italy no longer exists? There's somebody responsible for building the houses in a certain way that didn't work. It could be a human, it could be multiple humans, but the vulnerability is not in itself an abstraction. But we cannot abstract it in one single term in these languages. So my question was, okay, so when you run your community engagement participatory workshop in common, what did you do with vulnerability? Oh, we skipped it. We didn't talk about it, or we talked about something similar. So the terminology in itself is not going to be the solution to engaging with this concept, but it's a starting point so that people can agree what they're talking about. And the participatory practice that I'm referring to, in my case, were the ones about developing the skills to start the conversation. You're not going to create a word that corresponds to vulnerability. That's not how translation and interpreting work. It's not the point, because if you create a neologism, if you create a new word to replace the English, you're not helping anyone either. You may as well just pick up the English and put it in your language. It's not going to be useful. So the final expert who oversaw the version that is now published and available, a number of volunteer bilinguals, 11 members of the disaster management agency, 7 students of linguistics or experts in the various languages, 6 lecturers who teach linguistics in the 5 languages that were used, 4 translators professionals. Now, for me, this number is the best one because, of course, I come from a translation background. But translation and interpreting in terms of crisis communication, I've just tried to convince you that matter. But often, what they're left to is the last phase of planning before going and intervening in an international humanitarian operation. Oh yes, we need translators and interpreters, or we'll find them there. We took 9 months and we found 4 translators. And we were working with 5 languages. So imagine you being the emergency manager that in 5 days has to go and respond to a flooding event in Freetown, and you have to engage interpreters or translators locally. They're simply not there. Essentially, that's the bottom line. So how can you then engage in this communication, in this effective communication, if they're not there? Well, so Jonas started looking at what's available, what is happening within, in particular, the international humanitarian sector. Are we planning better? Are we doing steps? Well, all of these, which may be very common guidelines, very well-known materials to you, but the Compendium of Good Practices in Disaster Risk Reduction, there's 5 occurrences of language, and most of them refer to communicating efficiently, not across languages. So it's not the same. You can communicate efficiently in English, but if nobody speaks English, then you're talking to yourself. But that might just be me. I certainly talk to myself. In 2018, there was a book that showed promise, and it's a very important book. It's the Sphere Handbook. It's supposed to be a guideline for everybody operating in the response phase of a disaster. And it expects to provide interpreters and translators good recommendation. I remember a talk that Professor David Alexander gave a few years back and said, if we could analyze all guidelines and just select the numbers of times that people say should. Yeah, this is one of those. Sierra Leone should provide translators and interpreters the next time that there is the need for the international community to go and collaborate locally. Yeah, they should do that, but nobody can provide those translators. They're simply not there. Nobody can give them to you. There's no academic training in those languages. There's no training for being a bilingual trained interpreter in those languages, and they're needed. And Sierra Leone is a very simple country. If we're looking at the same problem and moving it to India, or we're moving that to even just Nigeria, where there are approximately 525 languages spoken, then imagine the multiplication of risk. You look at India, between languages and sub-languages, you're talking about thousands possible ways of communicating. So the principles are good, but you're not going to be able to do it with 3 days before you land. So things are changing, and particularly interesting as a result in part of the response to the pandemic is the change introduced to the multi-sector needs analysis, needs assessment tool, the one that is overlooked by REACH. And they are now collecting data about languages, because one of the principles about being prepared is knowing what you're going to face. But if you don't know which languages you need, you cannot prepare for them. It's obvious. So this is beginning to do something. And leading towards my final 3 points. How can we measure the success of this project in particular? I don't know. We need to wait 5 years down the line, see if the disaster managers have used this, if communities are engaging in disaster risk management. We're going to do a number of follow-up studies in the next 2 years, see if the terminology is being used. But for me personally, as one of those who wrote some of the "you should do these" guidelines, we proposed 10 simple guidelines as part of the Interact Crisis and Translation Network. They've been picked up by a number of agencies. They've been used to inform new practices, at least within the OCHA, the International Organization for Migration, and another couple of agencies that are trying to create a collaboration between expertise within the disaster risk reduction and management teams and people who can provide language support. We're not saying that you resolve the response to a disaster by having translators and interpreters. We're not saying something that simple. because it's not the priority. Priorities lie elsewhere. But trust is crucial. And if you don't have trust, and if people don't trust the communicative aspect, you cannot develop it overnight. And if you don't have the people to try even to develop it, then you have no chances. So the idea is now to go to the next phase, which is what's happening now with a number of your colleagues, postgraduate students here at UCL, who are working on transforming the terminology that is just a PDF at the moment with that cover, and transforming it into an app that will have a number of features that can become a multilingual app and can become a tool to be deployed for all languages that have a translation for the disaster risk reduction terminology. Will it do something? Not necessarily, but is the disaster risk reduction terminology doing something in the languages in which it's not translated? Well, certainly not. Not everybody speaks those languages. So we do have a very interesting setup. The idea ultimately would be to create an app that integrates with the early warning system, so that if disaster management agents in a particular communities are seeing a disaster happening and describing and discussing disaster response, there they can use the app also to integrate with the early warning system and see if neighboring areas, neighboring communities are going to be affected. Harry and Ilya, Wignon and Bobby are doing a fantastic job. They've already prototyped the app in the last 2 weeks. And our idea is that we're going to test it. We're going to see if it works, because the terminology is a translated text. What's the problem with that? Well, I won't expect at this time of the day that you remember my very long contextualization, but at a certain point I say that 49% of the people have got very low literacy levels. So translating in 5 languages, still, if you can't read, you can't read. Whether it's your language or somebody else's language, you still can't read. So until the literacy level go up, the app will also have audio searchable files, so you can find the terminology in your language and listen to an audio version of the term display. Will it change something? No, but maybe. What is expected to do is expected to increase the collaboration, is expected to increase the sense of engaging with this agenda as something that matters rather than something that is from somewhere else, from somebody else. At the moment, I think that this is promising, but I'm open to be proven wrong. What really worked is that we involved 100 people in 9 months, and there wasn't a single one of them who said, this is pointless. And we've had to turn down a number of people who wanted to work on this project. And we're going to carry on for another 2 years. The first question that UNDP asked us as soon as we presented the result was, oh, that's very interesting. 5 languages. Where are the other 23? Well, you gave us a good amount of money, and we supported a large number of people to do that. With 75,000 euros, we could do this. But we cannot train translators in another 23 languages without taking them there to the training center, delivering the training, organizing the training. What UCL did was we paid a trainer, and we delivered online training, but then everything had to be organized because of access to the YMCA center was crucial for people attending the training. And then the training was also delivered in various communities. That cannot happen without funds, but the funds that we used were immediately put to good use. So the terminology in translation was launched on the 29th of October and in 2021. 7 days later, there was the massive accident where an oil tank exploded, and the same guys who were celebrating the terminology the following week were there helping people being affected or spoke a good number of those languages that we covered. So this is something that people are using. This is something that people are likely to use. Will it go beyond Sierra Leone? I don't know. I want to hope that maybe as an idea can circulate. thank you for your time. Thank you for listening to me, and I'm happy for any question.
Thank you very much indeed. So I have questions now, but also, I mean, if you are listening online or listening to the recording, please put the comments into the discussion forum. Maybe we can get them and we can get answers that way. So.
I wanted to understand in terms of developing the app and ensuring that are we also talking about developing the technical capability of using the app amongst people who can use it, cannot use it? Because when we talk about literacy, we also have to see whether they can use the app in the end, and the majority of people can or not. Excellent
point. Yes. So we're starting, first of all, there's going to be an element of knowledge exchange. So UCL students are going to co-train students of Najala University at the end of the prototyping phase. So they're going to share the way in which the app is designed, but at the same time, the prototype is going to be tested by its users. So initially it's going to be disaster managers, then it's going to be NGO workers locally. And yes, we're going to test this so that there's somebody who can give longevity to the app. So excellent question. We've been working exactly on that, because otherwise if we deliver the app, somebody uses it, nobody knows how to make it survive, in 3 months is a useless piece of technology. And technology is not the only solution here. It's the knowledge that goes with it. So yes, thank you.
I have another part. Also in terms of increasing the literacy in understanding these terms, etc. Do we also need organizations to go down and work with communities after the project has ended? Because if we talk about countries which have more languages, suppose I come from India. In India, there is like, even if you move from one place to the other, you would have another language there. So in terms of that, we would need like a much bigger collaborative approach.
Yes, absolutely. So what we're doing here is, in July, as soon as we have the app with the audio files, because that's the crucial next part. As soon as we have the audio files, it's going to be used in new workshops to discuss and engage communities with principles of disaster risk reduction. And at that point, we'll see, well, it's making sense, it's reaching the right people, it's making people, it's not a question of empowering. I hate that term when it's used implying that people don't have agency. But it does give, if you don't know what you're talking about, you cannot be empowered. That's just banal, but it's true. So it certainly gives the starting point for the conversation to start. But we need to measure whether that is sufficient. And then that's where UNDP is really interested in the next stage. Is if that proves to be useful, then yes, we need to go for the other languages. And then ultimately we say to the UNDP, look, if we make it work, just talk to your parent organization, to the United Nations, and see if you can standardize it as an app that goes beyond Sierra Leone.
Yes, thank you for a talk that I think shows fearsome difficulties, but also just how immensely important this is and how it can be the key to an awful lot of other things. I think that's absolutely fantastic. Years ago, I tried to translate a paper called Engineering Geomorphology of the Lucanian Dolomites mountain range into Southern Italian dialect. This was hugely difficult. For example, to say there's a major landslide problem here, it comes out as tutta la pratica non go, which is a hideous oversimplification. And at times I thought I was even trivializing the concept. So the question I have, comparing my experience to your far greater experiences, when it comes to scientific terminology and a scientific way of thinking about things, how on earth do you manage with local languages that don't really have the tools to assimilate this?
And that was what our translator said. We don't have the technical language. We don't have the technical terminology to explain the science behind it. So paraphrasis has been traditionally the technique, just like the one you described, which, by the way, I'm Italian, but what Professor Alexander said, I didn't understand because I come from Central Italy. I wouldn't be able to recognize that dialect. Maybe something about stuff headed up on top of me, but I'm not sure if I picked up.
There you go. That was it.
That was it, okay.
So you did understand.
I didn't understand, but reconstructing it through my grandma's Italian rather than mine. The point though there is true, is how could they explain with the same term, the hazard, the effect of the hazard, and the relation between hazards and disasters? They couldn't, so they had to explain. So that's what traditional translators use, is gloss, explaining, until the terminology evolves. Now the problem there is striking the balance, because there's no point in going in a community and having created a new term that nobody knows, but also having only the non-scientifically accurate terminology isn't good either, because you're not going to participate to the bigger discussions about disaster risk reduction. You're not bringing in anything to the table. So it's where do you start? Where does one feed into the other is the problem. And our translators really said, you know, we need to go over this text in a few years. So maybe when the essential concepts are established, then you can start building up. But the technical languages in there, and some of these languages are used only orally. So today, Pius started recording and is using different number of people, and said, "Oh, I think we made a mistake here, because the ones who wrote the written corner didn't write it the way in which it's spoken. So the people are now trying to verbalize it, don't know how to pronounce or speak it. And there's always going to be a problem when a language predominantly exists in a spoken variety." I hope I kind of answered you.
Any other questions? So I've got a question. I mean, if we just waited 10 years, won't Google Translate have solved this whole problem for us?
That's a very good question. Now, look at Google Translate. At the moment, it's got 106 languages. How many languages do we speak worldwide? Especially the spoken one, 6,900 plus. Also, try to do it for a good language with a huge database of resources. And especially the newest version, there is a neural machine translation, so meaning one that mimics the working of the brains, is fantastic at hiding massive mistakes. So it reads very well, but it reads well because the target language, so the language into which it translates, is reorganized by looking at good sentence structure. It's not reorganized by looking at what the original said. So once it's done the first transaction, at the end it focuses only on expression to sound natural. And what is really difficult, and this is something that computer scientists are actually looking at, is that the machine learning techniques that they used to design these programs are very difficult to unpick when they produce a well-sounding translation that is actually full of mistakes. And for some languages, it continues to make a very small mistake, doesn't understand positive and negative statements. So you can translate as a yes something that is a no. So that's not a marginal error. And it struggles really very much with Yiddish for that. Plus, you have Klingon and you have Latin, but there's no Chrono or Creole or Limba. So as a tool as well, it's been developed for the globalized market. So the market that works on localizing video games. The push is more likely to come from audiovisual translations. Netflix is pushing the boundaries of our field towards still human translation, but in many more languages than machine translation can cope with. So no, I think I'll challenge you. Another 10 years is not enough. Maybe give it 20. I'll be retired by then, so I'm fine.
Any further questions? Okay, so I just like to remind you all, we've got the reception. Everybody's welcome to come. Do please come. We have to cancel, of course, our Christmas party, so there's the opportunity to meet many of you really in person for the first time. So it's in the engineering foyer. I would really like to thank you for a fantastic presentation.